I'm Danny Russell. I'm Vice President of the Asia Society Policy Institute, speaking to you from the epicenter that is New York City. Thanks for joining the webcast. I know this is a stressful time for everybody, and I hope that all of you are safe and healthy. This program is the fifth in a series that the Asia Society Policy Institute has put on the web, events on coronavirus, Asia, and the world. Past programs have covered the virus's impact on trade, on the Belt and Road, on US-China relations. Earlier in the week, we heard from Singapore's top public health expert. And with each of these programs, today we'd like our audience to participate in the discussion. So if you've got any questions, if you've got any insights, we want to hear them. Please use the comment function on YouTube or on Facebook, and I will get to as many of these as we can. But today or tonight, I'm going to be joined by a really outstanding Australian public servant, Richard Maude, for a discussion on Southeast Asia, how Southeast Asia is responding to the COVID-19 outbreak. It's an incredibly dynamic and youthful part of the world. Southeast Asia is critically important to the global economy and to the national interests of countries like Australia, like the United States. So the question of what's really happening there and what might lie ahead is vitally relevant. And that's where Richard Maude comes in. Richard was a valued colleague of mine when I handled Asia policy in the US government, and he held a succession of senior policy positions in his government, first as Director General of the Office of National Assessments, then as the senior policy advisor to the Australian Prime Minister, and for the past few years as the Deputy Secretary of the Department of Foreign Affairs and Trade, responsible for the Indo-Pacific region. And like me, Richard has moved from the not-for-profit public sector world to the not-for-profit think tank world. Richard, what are we missing here? Well, I'm very delighted that he has recently joined the Asia Society Policy Institute as a senior fellow and concurrently as the executive director for Asia Society Australia. We're very lucky to have him. Welcome, Richard.
Well, thanks very much, Danny. And it's great to be working with you again and to be talking to you and to our listeners from Canberra, Australia.
Great. So the world has just crossed the horrendous threshold of 1 million known cases, 50,000 deaths. By far and away, so far, the hardest hit countries are in Western Europe and the United States. You've got Italy and Spain, which each have fatality rates of over 200 deaths per million people in their population. And those numbers are climbing fast. And in Southeast Asia, you've got a region of 650 million people? So, wow. And as you pointed out earlier in the week in a really terrific piece in the South China Morning Post, that many of the hundreds of millions of people in Southeast Asia are living in very, very crowded cities. Many of these cities have extremely weak public health infrastructure and so on. So can you paint us a bit of a picture? Could you start us off by giving us just a baseline on coronavirus in Southeast Asia? What are we seeing, and what are we not seeing that could come back and bite us later on? What is the outlook for Southeast Asia?
Yeah, thanks, Danny. Look, if you look across all of Southeast Asia, which, as you say, is a really big region, very diverse region, many countries, the total reported infections are still not much more than about 10,000. Malaysia has about 3,000 cases as of 1 April, a bit over 3,000, and they have the most in the region. Thailand, about 1,800. Indonesia, about 1,800 as well. And then at the other end of the spectrum, you've got Myanmar reporting only 20 cases and Laos just 10. So, as you say, when you look at China, when you look at Western Europe, when you look at the United States, you would look at those figures and you would say, well, that's a great story. That's a good news story, really. But there are reasons for us to be concerned. First, the numbers have been climbing steadily. And with the exception of Malaysia and Singapore, we can't be confident that the infection rate will flatten anytime soon. Second, it's very likely that in many, not all, but in many parts of Southeast Asia's cases are going unreported. It's really hard to know, Danny, the true rates of infections because of the limitations in data. To give you an example, there's one recent study. It is just a mathematical modelling, so it has some limitations, but it estimated in Indonesia, for example, that less than 10% of the actual number of infections might be being reported in the official figures. And there is some anecdotal evidence that could be right. For example, the governor of Jakarta reported just this week that the number of Jakarta citizens who are being buried in accordance with the protocols for someone who is thought to have been died from the virus exceeds the actual official death rate. So the situation in some parts of the region is likely to be worse and possibly much worse than the actual reported numbers show. And then the third reason to be concerned is, as you say, Danny, many countries in the system have very weak public health systems. Some of these countries are quite underdeveloped. We see, as we've seen all around the world, shortage of personal protective equipment and also shortages of doctors and nurses. So even a smaller caseload can very quickly overload these health systems. And really the next weeks and months are going to be absolutely critical. We know from elsewhere in the world what a dramatic change you can see in infection rates just in a number of weeks. So the question that we're all watching anxiously now is, will we see the kinds of exponential growth that we've seen elsewhere in the world? Will these figures really start to escalate? And in a short period of time, we'll go from a relatively small number of reported infections, at least, to something much larger and much more serious.
Well, Richard, I do want to ask you more about that worst case scenario. But before I do, you mentioned Myanmar, for example, with only 20 reported cases. But a country like Myanmar has a huge border with China. Vietnam similarly has a very long border. Indonesia, which you spoke about, there were direct daily flights from Wuhan to Jakarta through, I think, the middle of February. I mean, it is, you had the Prime Minister of Cambodia, Hun Sen, visiting Beijing during the height of the outbreak. So there's a tremendous amount of cross-border interaction, and therefore just the extraordinarily low number of cases is mystifying to me. Now, Vietnam, the Philippines have 4 times Australia's population, but just a tiny fraction of the cases. Is it clear that that means that there is a 10-fold or 100-fold outbreak is waiting to be unleashed on this region, or are there other explanations? Maybe is there something to Donald Trump's theory that you know, the warm weather is just going to cure coronavirus?
Look, there's a very interesting discussion and lots of research going on now about whether the virus will do less well in warm and humid climates. I'm not an epidemiologist, but I don't think the science is settled on that yet, but there does appear to be some early evidence that that could be so. And we do know, Danny, that other coronaviruses have proved to be seasonal. I think when you listen to what public health officials in the region are saying themselves, and that includes the very senior public health official interviewed just this week by Kevin Rudd, the president of the Policy Institute that you referred to right up front in your opening. Those public health officials are very wary about the region relying on the possibility that a seasonal element to this virus could save them. It's a very new virus, so there is no community immunity. We do know, we have examples in the region where it is proved to be very infectious in large gatherings. So, for example, there was a large religious gathering that Malaysia hosted a few weeks ago, and there were many, many infections that came out of that one event, mostly Malaysian, but a number of other regional countries had their citizens infected, and they then carried the virus back home. So we do know that it can be very infectious. There are good examples of the way it can be very infectious in Southeast Asian countries when people are crowded together. And Danny, not all parts of Southeast Asia are very crowded, but many parts are. Java is, the island in Indonesia is densely crowded across the whole island. The big cities are lots of people crammed in together. There are still deep pockets of poverty. So there are still many elements that could allow the virus to spread, even if it is proved to be a fact that the warm and humid weather that most Southeast Asian countries have will slow the spread of the virus. So I think the best advice we have at the moment is that it could slow the course of the pandemic, but it won't stop it. It won't get you out of the woods, and it doesn't prevent the need for regional countries to really implement the sorts of measures we're starting to see across the region. So that's one possible explanation for the slower growth. The other possible explanation, as I said, is that the numbers are just going underreported.
Well, Richard, on the subject of different approaches taken by governments within the region, you mentioned Dr. Teo in Singapore, and Singapore has been typically cerebral and hands-on in responding to the coronavirus, even in the early stages, as he described. But more broadly, regionally, can you kind of walk us through the different public health approaches or social control approaches that the different Southeast Asian countries, the members of ASEAN, the Association of Southeast Asian Nations, are taking to try to keep the coronavirus contained? And I mean, do you see any patterns? How does that break down, would you say?
Yeah, thanks, Danny. It's it's a very diverse region, and it's not surprising that the responses are varied across the region. And also, Danny, just like in other parts of the world, the responses are evolving, sometimes really on a daily basis as the number of infections rises. In all countries, I think we're seeing a gradual tightening of restrictions, but some countries are starting a long way back. And there is concern that some are moving in the right directions. The menu that the Southeast Asian countries are using would be familiar really to all of us now. Border closures, you mentioned those Southeast Asian countries that border China, but all Southeast Asian countries, of course, are highly connected to the greater region. But now pretty much all of that has been shut down in one way or another. All the Southeast Asian countries are closing their borders to really all but their own citizens. Many countries have measures where their own citizens returning are quarantined. Most countries now are implementing social distancing measures of varying degrees of strictness, all the way up to fairly comprehensive lockdown. So Malaysia, for example, has had a nationwide lockdown for some weeks now. There are some differences. Testing rates are generally not high across the region, and also really detailed tracing is difficult for some of these countries. I think, Danny, we don't have time to look in detail at what every country in Southeast Asia is doing, but what I thought I might do is just illustrate 3 case studies, if you like, to give you a sense of approaches. Singapore is one. Singapore is getting very high grades from the World Health Organization and public health experts for its response. I suppose that's not surprising in a very small country. It's the most developed of the Southeast Asian countries, and it has a very strong technocratic public service. So Singapore has got a very sophisticated regime of testing, of tracing contacts, of isolating those who've been infected and who might have been affected. It also has a very comprehensive and very sophisticated suite of social distancing measures, probably amongst the most well-documented and comprehensive anywhere in the world. I can't go there myself, of course. We're all locked down traveling, but if you have a look on the web, you can get a really strong sense of how they're doing this. Awful lot of signs about where not to sit and how far apart to be, and an awful lot of masking tape showing people how they should be standing and to keep people at the right distance. In fact, if you look at pictures of some of Southeast Asian cities, masking tape is showing up everywhere these days. I suppose that's just a sign of the time. And so Singapore is really hoping with these measures that they can get ahead of the pandemic and really flatten that curve without totally knocking down the economy. Vietnam's another interesting case. It is a one-party state, of course, and that gives it some advantages. It's allowed it to move very quickly in a very coordinated way, using all the resources of the state. Vietnam moved very quickly to shut down their borders, to close down schools, to quarantine individuals in some hotspots. And they do seem to have been quite effective in keeping their infection rates down. But still, they're obviously worried because just this week they've moved even further and have introduced some very sweeping social distancing measures across the country with only essential businesses and services open. I've chosen Indonesia as a third case study because in some ways it's a bit different from those other two. Indonesia's President Joko Widodo has been reluctant to introduce very aggressive social distancing measures. He's been reluctant to lock down or quarantine, if you like, virus hotspots in the country, including Jakarta. And he is understandably very concerned about the impact that those measures would have on the Indonesian economy and on individual Indonesians, many of whom, of course, still remain poor and really eke out a day-to-day existence. And so the president seems to be pinning his hopes on trying to get their testing rates up high and to isolate people who are infected and trace those who have been in contact with them. That's a pretty hard job to do, of course, in a country as big as Indonesia. And this approach has been contested within Indonesia. There's a very vigorous debate going on in the Indonesian media about whether this is the right strategy. Some are urging much stronger and quicker action, medical profession, for example, and some regions and some cities also want to go harder with more intrusive social distancing measures and even locking down some parts of the country. Will it work? Well, we don't know. Jakarta is obviously now much quieter than it used to be, so people are trying to do the right thing and self-isolate. But it is quite a big gamble in a country that's as densely populated as Indonesia. And so the next few weeks or a couple of months will really be quite important to see whether this strategy is working or whether the pandemic gets away from the Indonesian government.
Well, that's quite a spectrum of approaches in the region. Thank you, Richard. And you started by highlighting the diversity of the 10 ASEAN countries. And I'll come back to the question of what some of the regional commonalities are. And more broadly, there's a lot of soul searching and a certain amount of hand-wringing going on around the world about whether democracies are really meeting the challenge of COVID and whether authoritarianism, as you alluded to, constitutes some sort of advantage and just what those advantages are. I won't put you on the spot by asking you if Thailand and Laos and Cambodia are authoritarian countries or not. But clearly the sort of political correlation is something that is going to be discussed and studied in this region and in others. But if I could, I want to switch to the question of the economy and ask you to help us think through the economic impact of the pandemic on Southeast Asia specifically. Obviously, as you've pointed out, there's a very widespread within ASEAN, not only politically, but in terms of development as well. You've got Singapore at the high end, as you said. You get, I suppose, Myanmar on the low end. But most of the countries in Southeast Asia have thrived on some form of economic openness, economic connectivity. Singapore in trade and finance, Vietnam and Malaysia as part of global supply chains, others, Thailand, Cambodia as tourist centers and so on. But whatever that integration was, it has been shut down by this virus. Moreover, all of these countries have an extremely high degree of trade dependency on China, but China's own economy has taken a massive hit and is largely shut down. Demand is down. So can you just walk us through the expected economic implications? What is it that you would anticipate for this dynamic region?
Yeah, well, Danny, obviously, as in the rest of the world, the economic impacts are obviously quite severe. And really, the economies have been hit from multiple angles. As you said, Southeast Asia's economies are very highly geared to China. And so when China shut down in January and February, that had an enormous impact, particularly for the manufacturing industry in Southeast Asia. It lost the raw materials, the inputs, if you like, for much of its manufacturing, and also a market for final goods at the same time. So we saw factories in Southeast Asia slowing down or shutting down completely, and lots of jobs being lost, with all the ripples that went through the economy that results from those sorts of job losses. Of course, it's not just China. Global demand right now is very, very low, and that is also affecting these very export-oriented industries. Tourism has been hit very, very hard in Southeast Asia, and it was a major part of the economies of many countries. It's been devastated by the shutdown in international travel and also by local restrictions on travel. And again, this affects not just the people who are formally employed in the sector, in the big hotels and the resorts, for example, but the hundreds of thousands of Southeast Asians who earn a living in and around the tourism sector. These are the drivers, these are the people who make and sell the handicraft, these are the people who run the food stalls. And so this impact has been widespread. And finally, of course, in many of these countries, as social distancing measures kick in, local demand is also down for goods and services. And this has a big effect on businesses, just as it is in all parts of the world, and a really big effect on the millions of Southeast Asians who earn a living in the informal sector of the economy. These are the Southeast Asians who still live on a day-to-day basis, really eking out an existence. And when people stay home and businesses shut, there's just not the income, the very small income to keep them going. And we're definitely seeing that right across Southeast Asia. Is there any light at the end of the tunnel? Not immediately, unfortunately, as is the case in other parts of the world.
I found this on the web for. Is there any light at the end?
For example, China's economy might recover or will recover, but we don't know if it's going to be a V or a U-shaped recovery. And even if China's recovery comes on, it could happen at a time when many Southeast Asian countries still have their own economies locked down, and global demand is likely to remain subdued for a very long time. And some industries, I think, are going to take a long time to recover. So how long, for example, would it be before we're all going to holiday in confidence in some of these countries? So tourism could take a long time to recover. So the outlook for the rest of the year is for, at best, a very significant slowdown in economic growth in these countries, and in plausible scenarios, a big contraction in economic growth for some of the big regional economies. The World Bank, for example, has just put out a really good summary report, and it has some modelling on hypothetical worst-case scenarios that would see economies like Indonesia and Thailand contracting quite significantly this year.
Thanks, Richard. You mentioned China, and I want to come back to that, and that's where most of the questions we've received on social media thus far I want to go. But I want to co-opt a question that came in from Murray McLean on ASEAN and what the crisis may mean for ASEAN. Is this a catalyst for institutional strengthening, or is it a solvent that's going to undercut the bonds? I mean, obviously there's the issue of the ASEAN economic community. You just described that the economy in the region is freezing up, at least in the near term. But presumably there could be implications for regional integration. As you've mentioned, borders are back, and connectivity has been a watchword for ASEAN. Is it now a dirty word because we are maintaining social distancing as countries as well as people? And more broadly, are the ASEAN countries pulling together to help themselves help each other out in the kind of spirit of ASEAN solidarity? Is there any kind of coordinated regional institutional response to the pandemic? How's ASEAN holding up?
Yeah, it's a great question. ASEAN, for watchers who may not be familiar with it, is the Association of Southeast Asian States. It's a 10-country organisation, and it's been at the heart of Southeast Asian regionalism for decades now. And its mandate is to promote economic growth and economic integration, the integration that you talked about, Danny, and also to support stability and peace in the region. I have to say, that it has not played a prominent role in the regional response to the pandemic. ASEAN has many official processes, and some of them have been meeting. So there is an ASEAN health senior officials process, and that is active. Economic and trade ministers have been talking. But this is really about the sharing of information and best practice. It is not about some kind of greater pan-regional response or coordination of national responses. Sovereignty is still a very strong concept in Southeast Asia, and so ASEAN sits lightly on top of 10 sovereign states. And really, countries are driving their own responses much more than anything else. So I think, we couldn't really say that ASEAN is playing any kind of strong role in the fight against the pandemic. It might be a bit unfair, a bit unrealistic to expect that it would. And generally around the world, we're not really seeing regional organisations or even big multilateral organisations rising to the challenge. I don't think we should draw too many conclusions from that. As I said, it would probably be always been unlikely that ASEAN would play much more than an information sharing, best practice sharing role. I don't think, Danny, to come back to your question about integration and connectivity, that we will see a Southeast Asia that will lapse into a series of isolated countries. It's very dangerous, of course, to forecast at the moment. Most of the forecasts we make about the future in a post-pandemic world, or many of them, could well turn out to be wrong. But the great economic story of the region has been the gradual breaking down of those borders, of the integration of trade, of investment, and flows of people. I mean, migrant worker flows are an essential part of the economy. And this is within Southeast Asia and, of course, back into China and elsewhere. And this is really the lifeblood of the Southeast Asian economy. So I think they will be very keen, as soon as they possibly can, to begin opening up that integration and that connectivity.
Well, thank you for that, Richard. So the pent-up demand, as I alluded to, is about China. And we've got questions from Patrick McLean and from Jetta Ella and from a number of other people with a variety of China-related queries for you. What is the geopolitical impact that we might look for from the pandemic and from its aftershocks? Specifically, how is this experience likely to affect attitudes and relationships between Southeast Asia and China, political, social, economic? For example, China's face mask diplomacy is getting a lot of attention, and the foreign minister, Wang Yi, convened a meeting of the ASEAN foreign ministers during the crisis last month, pledged assistance. There's clearly an effort, and so some of our listeners are asking what we should expect in terms of either Chinese interference or Chinese benevolent medical assistance. The flip side of it, something that you know all too well, since we lived through it, was the violence in Indonesia against ethnic Chinese after the Asia financial crisis in 1998. I think 1,000 or more Chinese were killed. Many tens of thousands were forced to emigrate. So I realize that predictions are treacherous, but how would you forecast some of the risks and the potentialities?
Yeah, well, I think the honest answer is we don't know yet, but there are some some trends, if you like, or some themes that we can talk about. I think, Dan, if you just step back, of course, all of us who love international relations and foreign policy can't help speculating about what the pandemic might mean for some of the big global stories of our age. And really, in our part of the world, there is none bigger than the rise of China in past decades. And it's something, of course, that Australia watches very closely. It's a story that we live and are engaged in our own interaction with Asia. And as China has become more powerful, its influence inevitably and understandably in parts of Asia has increased, and increased relative to all other external powers, including that of the United States. And China has, of course, immense advantages: its geographical proximity and the great gravitational pull of its economy. And of course, those of us who watch this have also watched that as China's power has grown, it has sought to shape the region to suit its interests, as any great power would do, to advance its economic interests, to encourage regional countries to defer to its security interests, and to recognise the legitimacy of Chinese Communist Party rule. And so it is worth thinking about whether the pandemic will reinforce this existing trend, that it will reinforce the growth of China's influence in the region, and will do so at the expense of countries like the United States and even of Australia. And of course, this is a debate, discussion that's being had not just about Southeast Asia. There's a lot of commentary around the world, as you know, Danny, about whether China or the United States comes out of this this crisis with its influence enhanced, and what this might mean for global perceptions of democratic versus authoritarian systems. And what we have seen in Southeast Asia, as we've seen in the rest of the world, with the virus at least seemingly contained or subdued in China, China's now on the front foot. It's promoting in Southeast Asia a very positive narrative of its role in fighting the virus. It is downplaying its own early missteps in Wuhan and emphasising or playing up what it calls a responsible and a resolute response. And it also has the advantage of a very large manufacturing capability for essential medical equipment, for masks, gloves, for gowns and respirators. And it's shipping these to the countries in Southeast Asia. Not all of this is donated. Some of it is purchased. And this aid, of course, is desperately needed. It's really important. And there are a few other countries in the world now who are better placed than China to provide it, provided that the quality of the equipment remains high. But as you said, there is also no doubt that this face mask diplomacy, as it's come to be known, is being used consciously by China to promote its own narrative about its handling of the virus, and to draw countries closer to it. Its aid has very high impact because the countries are flying it in or having it flown in for them. There's footage on the TV inevitably of planes being unloaded and positive stories in the media. And this is getting more traction than support from other countries. And other countries are giving support to the region. The United States is doing it. For those that are interested, there was a statement from the State Department just in the past few days, I think, that sets out how the US is helping Southeast Asia through the pandemic. I know that Australia is re-gearing a lot of our own development assistance to support pandemic responses. And countries like Australia and the United States have also spent many years, decades in some instance, with steady support to help build up public health systems. But this is undeniably just getting less traction, less attention in the region at the moment, as China uses its face mask diplomacy to win friends. So what will be the long-term impact on this? Well, I think, again, it's too early to tell. The early story is that those countries that already lean closer to China in the region, like Cambodia, are playing up this assistance. And I think it's having some effect there. But in countries in the rest of the region that are trying to stay in the middle, if you like, between China and America, it may have less effect. I think that the last point I'd say here, Danny, is that what China does is one thing, but there is really an opportunity here for the rest of the world and for countries like the United States and for Australia, who are long-term partners and friends of the region, to be stepping up, to show themselves to be steadfast partners, to be there in the region's hour of need. And I think that, more than anything, will be an important factor in how the pandemic affects levels of power and influence in the region.
Richard, I couldn't agree with you more, and I couldn't have said it as clearly or succinctly as you just have. We're coming up on our appointed hour to conclude. You've answered, frankly, many of the questions that have come to us on social media, including about Australia's provision of aid and other aspects of China, either its behavior or the prospects in connection with the coronavirus. So I want to thank you very much for that. That was really a clear and insightful presentation on the impact of COVID on Southeast Asia, both what we should be looking for and what we may in fact have to contend with further down the road. To our listeners and viewers, I want to say thank you and invite you to please tune in, as they used to say. Tune in next Tuesday, same bat channel, same bat time, at 11 a.m. Eastern time for our next webcast, which will be on coronavirus and Iran. That will be a conversation between my colleague Puneet Talwar and the International Crisis Group's Ali Bayez. So to all of you, thank you very much for listening, and stay home and wash your hands.